Week 7 residency reflection. So this week, it was good. It was tiring, not quite as tiring as the week before, which makes me feel a little bit better. Like maybe I'm managing everything a little bit better and kind of able to regulate my sleep a little better. I was able to get to the gym a few weeks, which was nice, or a few times, which was nice. In terms of actual stuff, the class was great. It was nothing too crazy there. Clinic is getting better. We've officially rotated. One of our floors now is neuro-specific floor, so my floor happens to be the floor for patients with stroke, and got to see a couple patients post-stroke, cerebellar lesion, and then parietal lobe lesion, and then a couple other patients on the floor that were a little bit more medically complex, but weren't necessarily patients post-stroke, just because there's not the patients coming in. But we had our baseline assessment at the end of the week, and that was really good. It was a nice way to kind of get a baseline of where I'm at in terms of that novice clinician towards that expert clinician, and to kind of figure out how I'm doing, how things are going, get to talk to the head mentor, and I mean, we talk on a daily basis anyway, but with a little bit more formal feedback and a little bit more of a formal assessment. Lots of room for growth, but that's okay. You know, I expected that, especially for the first one, and hopefully I can demonstrate some growth on the next couple ones and continue to be strong in the areas that I was more comfortable with and feel like I'm performing well with. So that was nice, and got to see some more acute strokes, which is nice. I haven't ever really seen any of those, and it was nice to see them and with my mentors and kind of be like, well, I've never seen this, but I'm going to go in there and kind of do it anyway, and realize like, oh, okay, like I can do this. I'm not totally incompetent, you know, I know how to do these things. And but at the same time, be able to have my mentor there during our mentor sessions and be like, hey, I tried this and it's not working, and I'm at a dead end for what to think. And with the one patient I'm thinking of specifically, he was a parietal lobe lesion, and we were working on sit-to-stand, and he was pretty weak in his legs, but I knew he would be able to do it, and he had complete hemiparesis of one arm, like no muscle activation, and I did what I thought would work in terms of my positioning and facilitation, and then tried a different way. Didn't quite work out, and then she was like, let me hop in and try something. So she tried away, and it was like totally easy. The patient got right up, no problem. And I was like, what the heck? Like, he was like a heavy mod to light max with me, and then when she did it, he was like a lighter mod, maybe a heavy min assist. And I was just like, what the heck? Like, it can't be that bad, right? And so then literally the next day we had a movement session with our residency director, and that's kind of all around her clinical pearls on movement analysis and how to do a really, really in-depth, thorough movement analysis, and how to position yourself, and how to use your hands very gently, and how to use your hands very specifically for patients to get them to kind of, you know, do what we want or get the response we want to see. And it was really nice because literally that next day we talked about doing sit-to-stand with a patient with hemiparesis and kind of hand placement and stuff like that. And it was like I got to bring the experience I had before right into that, and then I'm going to get to go in on Tuesday, because this next week our schedule is a little different, and put that right into practice in the clinic. So I really like that ability to learn something and put it right into practice, and take things right from practice, bring them into more of that learning lab / lecture style environment, and then bring it right back into practice. So that was a really, really neat experience. I'm excited to keep going, excited to keep learning more, and had another, you know, kind of aha moment this week of just like, I'm a physical therapist, and like I get to be seeing patients, and this is awesome. Like I'm doing what I want to be doing, and it's cool because like those moments just kind of hit me sometimes. Like I'll just be walking down the hallway, carrying my walker to the room, and it's like, oh, like I'm doing this. Like I'm a PT. So I had another moment like that this week, just totally randomly. Like was walking up to the floor, and I was like, wow, like I'm a PT. Like, I'm doing this. I'm like actually a physical therapist, and like they haven't kicked me out of the residency yet. They haven't fired me yet or anything like that. So that was really nice to have that moment just like kind of hit again, and to be able to keep going into more of these neurospecific diagnoses and getting more into the neuroanatomy. And yeah, excited to keep going. Excited to keep making videos and keep moving forward. So I can't wait to see what this next week brings. A little anxious. My co-resident and I have our lecture that we have to present this week at the end of the week, so a little nervous for that, but it'll be good. It'll be exciting. And yeah, that's this week's Residency Reflection. Thanks for watching.